Okay, Marianne, we can go.
All right. Hello, everyone. I'm Marian Tabi, and welcome to the WHO Africa Media Briefing on the first anniversary of the declaration of Mpox as a public health emergency of international concern. First, some housekeeping. You can choose the language you would like to listen to this press conference by turning to the globe icon on the bottom right of your screen and selecting your preferred language. Bonjour, je suis Marianne Tabi et bienvenue à la conférence de presse de l'OMS pour l'Afrique à l'occasion du premier anniversaire de la déclaration de la Mpox comme une urgence de santé publique de portée internationale. La conférence de presse va se dérouler en anglais, mais vous pouvez choisir la langue pour écouter la conférence en cliquant sur l'icône du globe en bas de l'écran et sélectionner votre langue préférée. Now let's introduce our panelists. Joining us from Brazzaville in the Republic of Congo are Dr. Patrick Otim. Dr. Otim is the Program Area Manager at the WHO Regional Office for Africa. We also do have Dr. Maury Keita, Incident Manager for Continental and Regional Response, Dr. Nixie Gumede Moletsi, Regional Advisor for Laboratory and Genomic Surveillance. We do have Ms. Aminata Grace Kobi, Technical Officer, Health Promotion. And also we have Professor Yabum, the Deputy Continental Incident Manager for Africa CDC. A welcome to you all, dear panelists. So I will start with you, Dr. Otim. Can you start by giving us an overview of the Mpox outbreaks in the region and also the response over the past year and how to strengthen the control measures? Over to you, Dr. Otim.
Thank you very much, Mariam. Good morning, good afternoon, colleagues and members of the press. Thank you for joining us today. We really appreciate the opportunity to share where we stand with the Mpox outbreak, 1 year after it was declared a public health emergency of international concern, the progress made, the challenges we face, and the road ahead. I want to thank sincerely our member states, the partners, donors, for their contribution, which has allowed us to strengthen surveillance, engage communities, expand laboratory testing, roll out vaccines. 1 year on, Mpox remains a serious public health challenge in Africa. 28 countries have been affected, with more than 174,000 suspected cases and nearly 50,000 confirmed cases. Unfortunately, 243 lives have been lost. Overall, in the last 6 weeks, the weekly number of confirmed cases declined by 34.5% compared to the preceding 6 weeks. We are working with the governments to ensure that this reduction is not a result of underreporting or low testing, but rather of the strong control measures that the member states have instituted. We currently have 22 countries which are still facing active outbreaks. One country, that is Côte d'Ivoire, has brought its outbreak under control and has not reported any new case in 42 days. Angola, Gabon, Mauritius, and Zimbabwe have also gone more than 90 days without any new confirmed cases. Across the region, the transmission pattern is mixed, with different strains of the Mpox virus, but the most dominant being the clade 1b and the clade 2b. WHO has been working closely with the Mpox-affected countries to strengthen their response. We developed the Global Strategic Preparedness and Response Plans and established the Mpox Access and Allocation Mechanism to streamline access to countermeasures such as vaccines, therapeutics, and diagnostics. Together with Africa CDC, we developed the Continental Mpox Preparedness and Response Plan. There was the version 1, and now we are implementing the version 2. And we co-led the implementation through a joint Continental Incident Management Support Team and working very closely with partners. Since August of 2024, WHO has worked closely with countries to boost response capacities. 13 of the 22 affected countries with active transmission now have vaccine deployment plans, and 8 are vaccinating the high-risk groups and contacts. Over 3 million doses, almost half of the target, have been delivered, and more than 951,000 doses administered, and around 900,000 people have been vaccinated with at least 1 dose of the Mpox vaccine. WHO has also deployed 112 international experts to Mpox-affected countries, trained over 4,000 healthcare workers, and delivered supplies and logistics and personal protective equipment worth $4.5 million and laboratory supplies to 30 countries to strengthen the response. We have also mobilized with generous support from donors, $76 million in funding to strengthen response operations in affected countries. Furthermore, testing coverage has improved. In DRC, for example, we moved from 20% testing coverage to 65%, which enables faster detection and confirmation of cases. Despite these gains that have been made, challenges persist, particularly limited access to vaccines, competing and concurrent emergencies, funding gaps, inadequate access to care, and stigma that keeps people from seeking care. The conflict in the Eastern Democratic Republic of Congo continues to disrupt response efforts. We need urgent action to secure more vaccines, scale up operational funding, and strengthen cross-border coordination to reduce the risk of spread into new areas and then beyond the continent. Our priorities for the next 6 months are really to expand community-based surveillance in the high-risk areas, procure and distribute essential supplies to the remaining hotspots, support the integration of Mpox response into other health programs for sustainability, and support targeted vaccination and advocate for more funding for the vaccine deployment. It is critical that we sustain what works, and what works includes rapid case detection, timely targeted vaccination, strong laboratory systems for early confirmation, and active community engagement. Fighting stigma is as important as fighting the Mpox virus. The communities must feel safe and supported to seek care. So we call on all of you to challenge the false claims about Mpox and share facts instead. WHO will continue to work with governments, partners, and communities to close gaps, advocate for and support equitable access to vaccines and treatment, and protect those most at risk. With the continued collaboration and solidarity, we can bring this outbreak of Mpox under control and protect the health of our people. Thank you, and over to you, Marianne.
Thank you so much, Dr. Patrick. Thank you for sharing those updates. We want to apologize to our audience for those initial technical hitches that we witnessed, and just to confirm that we are working on ensuring that we do have a smooth and impactful press conference. So I will now move over to you, Dr. Mori Keita. Dr. Keita, can you tell us about the continental collaboration to address the outbreaks in Africa?
Merci, merci Marianne. Bonjour à tous et merci d'être parmi nous. Cela fait aujourd'hui 1 an que l'épidémie de Mpox a été déclarée urgence de santé publique de portée internationale, marquant le début d'un appel à une mobilisation mondiale renforcée. Conscient de la nécessité d'une coordination plus efficace, l'OMS et les Centres pour le contrôle et la prévention des maladies en Afrique, communément connus sous le nom d'Africa CDC, ont créé en septembre 2024 la toute première équipe continentale de gestion des incidents basée à Kinshasa, en République démocratique du Congo, épicentre de l'épidémie. Cette équipe, qui est toujours en activité à ce jour, a réuni des experts techniques de toute l'Afrique et plus de 25 partenaires autour d'un plan, un budget et un cadre de suivi unique. Au cours de l'année écoulée, cette approche unifiée a permis d'harmoniser les stratégies nationales, d'orienter les opérations et de garantir que les ressources sont utilisées là où elles ont le plus d'impact et surtout en évitant la duplication. Ensemble, nous avons élaboré des lignes directrices pour les soins aux patients, la prévention des infections, la surveillance et la notification. Nous avons mobilisé plus d'1 milliard de dollars de promesses de dons. Nous avons obtenu et livré plus de 3 millions de doses de vaccins. Nous avons formé des milliers d'intervenants et nous avons déployé des experts dans les pays les plus durement touchés. Ces efforts ont certes contribué à la réduction de la transmission constatée au cours des dernières semaines, mais de nombreux défis restent encore à relever, notamment la crise sécuritaire et sanitaire qui affecte les populations de l'Est de la République démocratique du Congo, les déficits de financement, la fatigue du personnel de santé due à la réponse à des épidémies multiples et simultanées, ainsi que le nombre limité de tests et de vaccins. Pour mettre fin à cette épidémie, la meilleure voie à suivre est de continuer à travailler main dans la main avec nos partenaires. Nous devons préserver les acquis de l'année écoulée et poursuivre nos efforts avec la même détermination qui nous a unis au départ. Grâce à une solidarité durable et à la mobilisation continue des ressources, nous restons convaincus que l'Afrique parviendra à maîtriser cette épidémie de Mpox. Enfin, nous tenons à remercier nos partenaires, nos donateurs, les gouvernements et les intervenants qui nous ont accompagnés tout au long de cette riposte, dont l'appui constant a été déterminant pour l'accomplissement de cette mission. Et nous leur en sommes reconnaissants. Merci à vous.
Merci beaucoup, Dr. Keita. Maintenant, over to you, Dr. Nixie. I will now be passing the mic for you to tell us about the advancement in Mpox diagnostics. Dr. Nixie.
Thank you so much, Madam Chair, and good morning to everybody that is listening to us. I just want to add on to what our colleagues have mentioned earlier on in terms of the Mpox outbreak that has been taking place. So the virus itself has really raised awareness of the importance of the laboratory services, especially the fast diagnostic testing, monitoring of the virus transmission pattern, and also the changes in the virus that might affect some of the vaccines' efficacy, and also some of the testing methods that are being used. And also it's so useful to be making sure that we determine the variants and the clades that are currently circulation. However, all of this has actually exposed the general lack of accessibility, low availability, and poor quality diagnostic services that apparently the entire continent is facing. So with all of this, the WHO, together with its valued partners, in this case, especially the Africa CDC, have played a very critical role in supporting the laboratory system and networks on the continent. These efforts actually include the visiting of the countries, assessing the laboratory capacity and enhancing the workforce skills, especially for the laboratory technicians, as well as developing the testing capacity and strategies so that everybody is having a standardized protocol for them to be able to test the samples that are directed to them. In addition to that, we have actually engaged with the partners in terms of evaluating and validating some of the point of care testing, and this and also for us to be able to get a very rapid results to try to beat the turnaround time. And then what we are currently emphasizing as WHO is to encourage the countries for integrating the Mpox testing with some existing surveillance strategies, such as the testing of Mpox together with the HIV and syphilis samples that are delivered to the countries. So this is one of the areas that we have seen a progress that has been taking place in most of the countries. However, to add into that is that we are now starting to see a very sustained laboratory capacity across in all infected and affected member states in the entire Africa. And then it's been said earlier on that most of the countries have reached above 80% of the testing coverage, which is our target at this point in time, and that this is quite encouraging. So focusing to the laboratories themselves, we are seeing that most of the samples that are delivered into the countries, they actually get tested within 24 hours, which is quite very encouraging because that was quite a lot of delay previously. And then also to add into that the decentralization strategy that has been developed by WHO together with Africa CDC have shown quite a very quick results turnaround times in most of the countries. For instance, if you can make an example, DRC started with only 2 testing laboratories. As we are speaking now, there are close to 27 labs that are doing the testing. Moving to Burundi, they started with 1 testing lab, and then within a very short period of time, they've expanded their testing facilities up until 2023. And then we've just came back from Malawi, where they were also having only 1 testing lab. And then currently they've expanded to more than 20-something testing sites within the country. And then in all, we can actually sum up and say that most of the samples that have been delivered into the laboratories, close to or more than 104,000 samples have been lab confirmed. This is an indication that the laboratory has really upped their games in terms of building a very good structure and also having a turnaround time that is so speedily for the program to take actions. However, as much as I've been saying the good news about the response that has been given to the countries to support them with their Mpox outbreak, we are still facing some challenges in certain areas. For instance, the turnaround time in terms or the delays in terms of the sample transportation from the peripherals to the testing laboratory is still an issue. And then this one can actually impede the timely diagnosis as well as the public health response. And then also, as much as we mentioned the decentralization method, not all the countries have really engaged themselves to have a larger number of testing sites. So this is an area that needs to be addressed as soon as possible. The other challenge is the shortage of essential reagents, consumables that are actually disrupting the testing continuity. And there's an issue related to the data harmonization in some of the countries. So there's a need that we need to harmonize, especially the surveillance data together with the laboratory data, so that a correct and accurate data information gets reported. And then to further achieve all of this, I think as countries and working together with WHO and other partners, there is a need that we need to do a very close interactions with the countries and accelerate the procurement system, as well as enhancing the transportation mechanism, which is one of the areas that has not been really reached the target that we wanted. And to end to this, Madam Chair, is that WHO is really working very strongly with the partners to establish a strong laboratory system that is not only going to be supporting the Mpox response, but also a system that is going to be sustainable and also be a prepared system that whatever outbreak might take place in the future, each and every country will be able to respond to that with a well-established laboratory system. Over to you, Madam Chair. Thank you so much.
Thank you, Dr. Nixie. Thank you for those details shared on diagnostics and lab. I would just kindly request all our panelists when giving out your proposal, please ensure that you give it out slowly so our colleagues of the press can be able to grasp all this important information that you're giving out. With that said, let's move to Ms. Kobe. Ms. Kobe, could you tell us about efforts in engaging communities to prevent and control the outbreaks, as well as ongoing work to address stigma? Over to you. Ms. Aminata, are you there? Can you unmute your mic? And please, if you can go slowly for our interpreters to do the interpretation.
Can you hear me now?
Yes, we can.
Sorry.
Yeah, over to you.
Let me start again.
Yes, yes.
Ladies, thank you very much, Madam Chair, and sorry for that little itch. Ladies and gentlemen, members of the media, colleagues and partners in public health, community engagement and stigma reduction are the fundamentals of our Mpox response. We cannot control outbreaks without communities' trust and participation. As you are aware, behind every case, there are communities and families. And it is through engaging these communities that we have made real strides in preventing and controlling Mpox outbreaks. We have built trusted partnerships by working with traditional leaders, religious leaders, and other community stakeholders, including reaching marginalized and vulnerable groups, such as men having sex with men, sex workers, and people living with HIV and AIDS. We have also trained community health workers who live in affected areas. We have supported the development of health literacy materials in local languages with culturally appropriate messaging. In the area of community engagement, from the beginning, PHEIC's communication and community engagement were placed at the heart of our response across the region of Africa. Governments, the World Health Organization, WHO, the Africa CDC, UNICEF, IFRC, and several international and local organizations have launched campaigns to educate people about Mpox, its cause, its symptoms, how it spreads, and most importantly, how to prevent it. Local health workers and community-based organizations became our frontline educators in remote villages, in urban centers alike. They built trust, they dispelled myths, they encouraged early reporting. For example, in Ghana in 2004, early awareness efforts rapidly contained the outbreak. That is the power of proactive outreach. We also trained police officers, immigration officers, and border agents, ensuring that our points of entry became points of protection. In countries like DRC, Gabon, and Guinea, this has helped prevent cross-border transmission and also kept communities safer. In the area of vaccination, we have supported the mobilization of public in countries like DRC, Sierra Leone, Uganda, Liberia, and Rwanda. We have been involved in community engagement drives that promote vaccine acceptance. By listening to concerns of the public, addressing misinformation, and involving local leaders, we have seen uptake in vaccine use, especially in areas where fear held people back. Members of the Fourth Estate media Stigma leads to delayed care seeking, reduced testing, and increased transmission. We recognize this early, and through infodemic management, we've been able to develop culturally sensitive messaging and done targeted outreach. We've worked to reduce stigma and promote inclusion. We've also worked with survivors who have been able to deliver their testimonies about recovery, and they've been able to return to normal life. We've also built partnership with the media so that there will be responsible reporting. As we look to the future, our focus must shift from emergency response to resilience. We must ensure that communities remain informed, empowered, and supported. This means investing in community health systems, psychology, psychosocial support, and ongoing education. It means that we continue to listen to the public, we continue to learn, and we continue to lead with compassion. Let us honor the tireless efforts of health workers, community leaders, and everyday citizens who have stood at the front line in this response. And let us remember that the fight against Mpox is not just a medical fight, it is a social, it is communal, and it is ongoing, and it involves all of us, including the media. Thank you very much. Over to you, Madam Chair.
Thank you so much, Ms. Kobe. Thank you to our panelists for this overview. Now that we've heard from all our speakers, we will now open the floor to you journalists to ask your questions. We want to remind you that this is a media briefing, and we ask all the people in attendance to bear with us as only journalists' questions will be answered. Dear colleagues of the press, please use the question and answer function on the Zoom application to ask your questions. Remember that you will need to provide a name and the name of the media organ you represent to have your questions taken into consideration. Also, do take note that if you want to ask a question live by raising your hand, you also do need to take the time to introduce yourself in the media and your media outlet you represent in the Q&A function to be given the floor. So I will now go. It's my understanding that Paul Adeboju has a live question. Paul, you can come in with your question, please.
Thank you for this opportunity. So my name is Paul Adeboju, and I'm a science journalist with The Lancet. So our first question goes to Dr. Patrick. About a year ago, Africa CDC issued its first public health emergency of continental security, and the next day, WHO declared a public health emergency of international concern. And over the years, when the Africa CDC's triggers or guidance have differed from WHO, I know you are both working together now. I want to know what mechanisms you both have used to agree on a single operational line for member states. And for Dr. Mori, I have a question. Since WHO pre-qualified the Bavarian Nordics Mpox vaccine, and Africa CDC and WHO jointly updated the Joint Continental Plan in April, what is the current guidance for allocating scarce doses in Africa? I'm curious to know who sees signs of the final allocation, and what is the current path to move beyond donations to pooled procurement or tech transfer. Thank you very much.
Thank you so much, Paul. That question is directed to you, Dr. Mori, and after that, we do have the Africa CDC expert on board as part of our panelists. Dr. Mori?
Yeah, thank you very much for the question regarding the vaccine allocation. So for the vaccine allocation, I think what we can say that, as you know, there are two pre-qualified vaccines, so the LC16 and the MVA-BN. So the Bavarian Nordic is producing MVA-BN. So recently, based on the doses that are available, the TRC. We have what we call a TRC. It's like an independent organ, in charge of discussing all the issues related to vaccine, and also responsible for allocating vaccine to the countries based on the needs and the AP situation and so on. And when this allocation is done, a formal email is sent to the MST is sending the email to the country for the country now to accept the allocation and to provide the that are required. Once this is also done, the vaccine are shipped to the countries for the vaccine rollout. So for the moment, recently, I think we are even the last allocation was done just a few weeks ago, and we have already received response from a number of countries, but yet waiting for others to accept and to move forward.
Thank you, Dr. Mori. Thank you so much, Dr. Mori. Thank you again, Dr. Mori, for those response to Paul's question. I would like to invite Professor Yap to weigh in on this question as well. And Professor Yap, please do also give us your remarks generally on the response as you weigh in on this question. Over to you, Prof. Yap.
Thank you so much. It's really a pleasure to be here with our brothers and sisters on celebrating this 1 year of the declaration of the PHEIC and the PHEICs. I think to start with, it's important to highlight this is the first time that Africa CDC, WHO come together to respond to the outbreak in the continent. I think this highlights a strong African leadership and a strong global allyship, understanding that this is a global crisis. And then the IMST, which is led by the two organizations, also have those more than 28 different partners. Because also we realize that that is critical. And later on, the financial environment has actually shown that with limited resources, there's a critical need to be more efficient. And being more efficient is to work as one team with one plan, one budget, and one monitoring and evaluation framework. I think that those are the key point. And just to ensure that we were moving well together, we have that interaction review that happened, I think was in December last year, where we paused together with the member state to find out how are we working together, how are we responding to this outbreak. And that led to the second plan, where we focus on the identification, the integration, and the legacy. And within those integration and legacy, I think Dr. Nitsi and Aminata also have highlighted how it has impact on the lab decentralization, community engagement, and so on. So a lot has been achieved. And on the specific side of the vaccination that has been mentioned, we've managed to mobilize the pledge for 6 million doses of vaccine. So as today, 3 million has been actually shipped to countries, which means we still have that gap. And knowing that we have new countries that are coming and then are requesting for vaccine, we are moving all together, finding some new innovation, the use of fractional dose, the reinforcement of the target vaccination approach. I think being all together with this strong leadership and all those members is really the way that is pushing us to be more efficient. And I will end on saying that this model that has been used for Mpox has now been called by the head of state to move on integrating cholera as part of the IMST model. So I think this is a very successful partnership, which I believe and I hope will be the model on how Africa responds to outbreaks. Thank you.
Thank you, Prof. Yap. Thank you for your remarks also generally on the response. I would like to call Dr. Otim to weigh in as well on this question from Paul. Dr. Otim. Dr. Otim, I think you're muted. So while we are waiting for Dr. Otim, I do believe that we also have a live question. All right, so I will take in this question while waiting to sort out the technical issue with Dr. Otim. We have a question from Africa BBC Chiguzi Ohaka. In the face of widespread cuts to international aid, how can low-income countries realistically implement the response plans WHO recommends, and what alternative funding or support mechanisms is WHO mobilizing to ensure response is sustainable? So I will hand over to Dr. Keita Mori while we are waiting to sort out the technical hitch we have with Dr. Patrick. Dr. Keita, please, over to you.
Okay, thank you very much. I do also have some colleagues online, so we'll be able maybe to supplement. Yes, for this response, I think, as you have seen, epidemiologically speaking, all the cases are coming from low-income countries. And these are the countries where we are also supporting the response. So nowadays, we are trying to develop what we have just mentioned, a transition plan. We know that Mpox, maybe the PHEIC will probably, I don't know, maybe will lift it during the next emergency committee, probably based on the progress we are making. But this doesn't mean that the Mpox will be ending in a few weeks or maybe in few months. So it means that we need to continue accompanying our countries to be ready, or maybe to integrate, the Mpox detections in the system, routine systems. So, and we also know that there is I mentioned it in my speech. There is a big issue with the funding. With this issue, and low income countries are the most affected. So it means that maybe they will not be able to respond to the big outbreaks, but we need to continue accompanying them, and to make sure there is an agile systems allowing healthcare workers to respond to different issues. So Mpox is now going to be like integrated in the system, routine system. We are trying to guide them. So we are developing now a guide which will be validated in the upcoming months, and try also maybe to be implemented just after, if this PHEIC is lifted, then we will start implementing this integration plan. So for the funding issue, I think it will remain, but we just need to re-strategize, to rethink, to make sure there is a mitigation measures so with small funds, we will be able to do more impact. So this is our strategy in the low-income countries.
Thank you, Dr. Mori. Is Dr. Patrick back? All right, just to also notify that we do have additional experts on hand. We do have Dr. Michelle Mutebi. And to you, Dr. Michelle Mutebi, we do have a question from the Daily Nation in Kenya. What is being done to the truck driver situation that is fueling cases between Kenya and Uganda border? What is being done to the truck driver situation that is fueling cases between Kenya and Uganda border? Over to you, Dr. Michelle.
Thank you very much, Madam Tabi, and thanks for this question from the Daily News. Yeah, so regarding what we know that Kenya and Uganda are doing regarding these truck drivers that are part of the driving factors leading to a high transmission of Mpox in the two countries, but also at some point crossing Tanzania as well. There has been quite a number of engagement in terms of cross-border coordination meetings that have taken place. And one of them, actually a big one, took place in Uganda, where all the key stakeholders came together to think on how they're going to coordinate and how they're going to approach this issue. And that's what led actually to the sharing of information. And then following that, investigations were done. And that's how they were able to pinpoint on exactly the occupational categories that are involved in this transmission, the truck drivers, but also the female sex workers. So there is a network. And just to address this, we supported the countries with a good strategy of engaging them in terms of communicating on the risks for contamination, to raise awareness among these communities. And I think it has paid off to a point where we started seeing that the number of maybe truck drivers and even in the sexual networks, those who were infected or new infections started decreasing, and added to that, like the strategy also of vaccination, but rather in Uganda, because it has not yet started in Kenya. So this has helped to address these issues of the truck drivers, but we don't want to stigmatize. But it's just those who are traveling and are very mobile, and they've been attended to. But of course, we still have some gaps that are related to the mobility, because once you identify them, you also need to do contact tracing, and it's still up to now kind of an issue, because sometimes they do not want to reveal the people that they've been in contact with. And at the same time, if they've been in contact with, those ones have also moved along that corridor going to Mombasa. We continue, and we are continuing to support these countries. And as I said, we have already seen positive results in Uganda, and we are expecting to see the same in Kenya. Thank you.
Thank you, Dr. Michel. Thank you for elaborating on that question. We have a question, and it is directed to you, Sheila Sasiwe. And this question is about Mpox vaccines. With limited access to Mpox vaccines in many African countries, what is WHO plan to ensure equitable vaccine distribution, especially in regions currently most affected? And how soon can at-risk populations expect large-scale solutions? Over to you, Sheila.
Thank you very much, Marianne. So we still have a very big challenge with access to Mpox vaccines in the African region. But in coordination with member states, WHO and partners, Gavi, UNICEF, CEPI, and Africa CDC have established the access and allocation mechanism last year in September, after the Mpox had been declared a PHEIC. It's a global solidarity mechanism to increase access to vaccines for people at high risk, and also ensuring that the limited supplies are effectively and equitably used. So the very limited supply, which is currently mainly from donations, which are very limited, and these few doses are being used to control the outbreak by mainly targeting or vaccinating only the high-risk groups and contacts of cases to interrupt transmission. But in future, if we have stable supply, then we'll also broaden the groups for vaccination to include other population groups at risk and increase population immunity. But right now, the focus is to really interrupt transmission and stop the current outbreak by vaccinating the high-risk groups and contacts of cases. As Michelle just explained a while ago, for instance, in Kenya, the target is to vaccinate the truck drivers, the sex workers, people who are identified from the epidemiology as being at high risk of getting the Mpox. Yeah. Over to you, Marianne.
Thank you, Sheila. Thank you so much. Dr. Patrick, if you're back, I would like you to weigh in on this. And if you did miss the question, permit me repeat, with limited access to Mpox vaccines in many African countries, what is WHO plan to ensure equitable vaccine distribution, especially in regions currently most affected? And how soon can at-risk populations expect large-scale solutions? Dr. Patrick, kindly weigh in.
Thank you very much, Marianne. And I believe that my colleague, Dr. Sheila, has ably addressed this question. I just wanted to add two aspects of it. One is, of course, that the issue of equity in access to vaccines is at the core of our approach to the access to countermeasures. And the mechanisms that Sheila did explain that were established really are really designed to address the issues of equity. The focus is on ensuring that the allocation of vaccines is guided by needs. What is the epidemiology in the field? Where is transmission more intense? Where will we draw more benefit from the deployment of the vaccines in terms of the goal of interrupting transmission? So that is the focus, and therefore the allocation is not based on any other factor, but it is equity-based, based on where the epidemiology shows that there's intense transmission. That's the first one. The second one, on the premise of the question, which I know has been raising some issues, that we, as Sheila has mentioned, with the limited doses that we have, we are not aiming at having large-scale campaigns currently, but what we are focusing on is targeted vaccination, aiming at areas where we have intense transmission, aiming at the priority risk groups that have been identified from the epidemiological investigations, aiming also at groups that are at risk of severe disease, particularly those that are immunosuppressed. Those are the people that we are targeting. So it's going to be targeted for now until we maybe have sufficient doses of vaccines, and we have achieved our goal of control of the outbreaks in the hotspot. And then we can expand that, now aiming at building immunity. But now the focus is interrupting transmission. Having weighed on that, I think there were two other issues that I had missed on because of the technical hiccups. I would just like to comment quickly on the issue of the continental. There was the question from Paul on the continental response, and my brother, Professor Yob, did address that quite well. I just wanted also to highlight two issues. That in terms of our approach to responding to Mpox, we have really been aligned. First, at the global level, we have regularly developed the global strategic preparedness and response plans, which are aligned to the continental plans that we develop, so that we are not speaking different languages. So whatever guidance we give to member states are really aligned with what we are speaking at the global level and what we are speaking at the continental level. And then secondly, once we have developed the continental plan, that we, through the incident management support team, which we are jointly co-leading with Africa CDC, and where other members, other partners are also collaborating in, then we have a unified approach, speaking one language, going to the countries. It also helps us, instead of having different multiple engagement with the member states or duplicating efforts, that we are really streamlined, and the few resources that we have are going to the areas where they're much needed. So it's been a very, very important approach to ensuring that we are aligned. And lastly, I think even when you look at the IHR Emergency Committee, and also the Committee of Experts of Africa, CDC, there's also an overlap, so that the guidance that comes in terms of recommendations on the temporary recommendations for the IHR Emergency Committee and the effects from Africa CDC, that there's no much divergence among us, so that we are all making the same sound recommendation to the member states. Over to you.
Thank you, Dr. Otim. Thank you for those details shared. I will now move over to you, Ms. Kobe. We do have a question on community-based prevention strategies. And the question is, what concrete community-based prevention strategies is WHO promoting in Mpox hotspots, particularly where misinformation, weak health infrastructure, and stigma may hinder public health outreach? Ms. Kobe, over to you.
Thank you very much. As WHO, we are focusing on building partnership and trust. So we are building partnership with communities. We know communities have trust in their leaders and health workers that they are working with. So we are building this trusted partnership also with religious leaders. We are also working with community health workers in these communities. They are being trained and they work with communities and they provide feedback to us on what communities are thinking. We are also working on listening to the communities actively through media listening to community feedbacks, and we're using this information that are being provided in these communities to re-strategize and answer community questions. We're also working with the media. Members of the media in our countries are being trained. And once they are being trained, they use their platforms, opportunities to engage the public and continue to pass trusted information to these communities. There are specific community members that are being left out. They are also marginalized. We use specific strategies to reach these through their own organizations. Like we are talking about truck drivers in the area of Kenya. They have associations. We work through these associations to reach out to them. We have people living with HIV, and they have associations and they have organizations that are working with them. So we work through these organizations for sustainability to reach out to these communities. We also have survivors of Mpox. We've worked with them to further engage the communities and show communities that yes, Mpox can be cured, especially if you go for early treatment. So these are some of the strategies we've been used to constantly engage communities, build trust, and ensure that they know what to do. We've also been able to translate key messages, prevention messages in local languages so that people are really able to fully understand how to prevent Mpox and how they can be engaged to protect their families and loved ones. Over to you. Thank you.
Thank you, Ms. Kobe. Professor Yap, do you want to weigh in on community-based prevention strategies in Mpox hotspots areas?
Yes, definitely. I think she has mentioned the most critical part. There is nothing that we can do without our communities. That's where everything's happened. That's why all together we've really decided to put the focus on the use of the community healthcare workers. And that has been highlighted by all the different member states. We were last week in Sierra Leone, where they launched the operation End Zero Case by the end of August. And they focus on the use of community healthcare workers for the detection, for the surveillance, but also to ensure that we don't have those stigma, because there was a question about the truck drivers in Kenya. There has been talking, we've been talking about the sex workers as the key driver. But it's critical to ensure that we send the proper information in the community, because then if one woman, for example, will have Mpox, then the husband might think that it's because she's a sex worker, which is not true. And the use of the community healthcare workers and the RCC colleagues, the fantastic job that they've been doing, ensure that we have the proper information and then we fight against the misinformation. That's the only way we believe that community engagement will actually shape the response. And I believe that we'll continue that from Mpox, but also moving to cholera. Thank you.
Thank you, Professor Yap. Juste pour nos journalistes francophones, juste pour rappeler qu'il y a une session en français après la clôture. Donc, Dr. Mori Keita va rester pour toutes vos questions. And I do understand that we do have a live question from Leon. Leon, you can ask your question live.
Thank you so much. My name is Leon Lidigu from the Nation Media Group. Now, my question goes to the experts in regards to the testing kits that we are using in Kenya for Mpox, because according to some experts who I've spoken to, they're saying there might be concerns that we are getting a lot of false negative test results. I don't know what WHO is doing about it. Thank you.
Thank you, Leon. Dr. Patrick, then Keita Mori. Dr. Patrick.
Thank you very much, Marianne, and thanks to Leon for that question. I would pass it to Nixie to answer, but just when she was submitting, she did mention we have been running a number of evaluations, and recently we did collaborate with the Robert Koch Institute in Germany to validate a number of the test kits that that we have across the region, so to ensure that actually we are not getting any false negative results. But I would like to pass it to Nixie to give a little bit more detail on what is being done to ensure that all the test kits that we have are actually reliable. Nixie.
Thank you so much, Dr. Patrick. Just to weigh into what you have said, yes, there was quite a concern previously of some of the kits that I don't want to mention the name in terms of the number of high negativity rate that was seen by different laboratories. So action was taken by WHO. We conducted the RKI, as Dr. Patrick mentioned earlier on, to do the evaluation and validation of those kits. And then we did receive a report that apparently there's absolutely nothing wrong with the kit that was causing a concern. So we do have that report that has been sent to those countries that actually reached out to WHO about the concern regarding the kit. So further to that, we advise the countries also to look at other differential method of doing the testing instead of Mpox. And then those that manage to embark to those additional recommendations coming from WHO, they came back to us and informed us that apparently they managed to detect other pathogens apart from Mpox, which they do have like rash-related illnesses. So the concern here, it might be, we need to look at the collection of the samples that are coming from these patients. How is our case definition when it comes to the collectors of those samples in those particular countries? So there's still a need of training in all areas when it comes to Mpox response. It's not only linked to the laboratory problems that is always pointing every time there is a problem in the field. So there is an overall need of doing a thorough trainings in those countries that are having a concern with different kits, because there's a lot of things that has been done in terms of the research of the kits that were of question to this matter. That's an advice that you can give to the countries. Please, let's emphasize in building more capacities in all areas when it comes to Mpox response, so that we will know where the issue or the problem is. Thank you so much, Madam Chair. Back to you.
Thank you, Dr. Nixie. Dear colleagues, we are now coming to an end of this virtual press conference. Let's turn over to our panelists and hear any final messages. Dear panelists, you've got 1 minute each, beginning with you, Ms. Kobe. Aminata?
Yes, thank you very much. Sorry. Okay, thank you very much for the participation of colleagues and journalists. We just want to continue to partner with you, as you are always in touch with communities, to continue to mobilize communities to come up for reporting early and also ensuring that they protect themselves from Mpox. Have a good day.
Thank you, Ms. Kobe. Now passing the mic over to you, Dr. Nixie, for your final message. 1 minute, please.
Wonderful. Thank you so much, Madam Chair. I'm just going to stick to my last message when I was giving my speech. What is actually needed in the entire continent when it comes to Mpox response or any other outbreak response for that matter. We really need to push to have a well-established laboratory system. We need to arm the game in terms of meeting the requirements of each and every country. Let's act as soon as possible. We get a message of one case being reported, and then let's make sure that we've got enough supplies for the laboratories to be able to do the testing. And then in addition to that, as we know that every time the outbreak is ceasing out, most of the people, they are dropping their microphones down. Let's emphasize the fact that each and every episode is actually preparing you for the next episode. You don't have to leave things because the Mpox outbreak is over. Then you cannot now go back and do some other additional things that are needed for you to make sure that your competency is maintained. You have enough buffer stocks for you to be able to test some samples, and the list goes on. So let's really work as much as possible with the countries to emphasize that. Let's keep our competency and support from all the partners and donors, support the countries as much as we can for each and every event that might take place. Thank you so much, Madam Chair.
Thank you, Dr. Nixie. And moving over to you, Dr. Maury Keita.
Thank you. Thank you. Personally, I think my final words will be emphasizing on the partnership, because effective partnership are crucial for successful epidemic and pandemic outbreak response. You know, this collaboration, like we are now doing with Africa CDC, is a practical example. But it's not only at the continental level that the game will be changed. This partnership, this collaboration should involve, government, healthcare organization, communities. I think Aminata has emphasized on the role of the community. We used to say that outbreaks are starting at the community level and they are ending at the community level, so that community should be at the center of all our intervention we are doing. So this is what we are promoting at the continental level, and this is what we are trying to push forward. So we will continue as continental IEMs to make sure that our member states are provided with the necessary technical and financial support to make sure that the band are covered in a few months. Over.
Thank you, Dr. Keita. We move over to you, Professor Yap, for your final message.
Thank you so much again for the invitation. I think I will send a big thanks to the journalists, because those are the ones who ensure that the information is moving around, but also they are the ones who are making us accountable, because through the question, through the media engagement, we are sure that we provide the information about what we are doing. And of course, thank you for the partners, the member state, and all the colleagues, really, to all our colleagues who are every day in the field, sometimes in a very difficult situation, in crisis in the eastern part of DRC, in South Sudan, and you can name all of them. So big thanks to them as well. And of course, a word to all those families who have lost their relatives due to Mpox. We'll keep on fighting and ensuring that we reduce the risk of that happening. Thank you.
Thank you, Professor Yap. Juste pour rappeler aux journalistes francophones que Professeur Yap et Dr. Keita va rester encore parce qu'il y a une autre session en français après ça. Donc, I will now pass over the mic to you, Dr. Utim, for your final message.
Is it me? Marian,
Dr. Utim, yes, please.
Okay, thank you. Thank you very much. I have 3 messages and a word of thanks. The first one, from the epidemiological standpoint, but we are not yet out of the woods. And experience has shown us from different responses when we are almost at the tail end, when the transmission is low, that usually member states relax. All of us as responders, we relax. And once we let our guard down, it gives room for resurgence so that the transmission comes back again. So at the point where we are now is the point where we should double our efforts and ensure that we close all the remaining chains of transmission as soon as possible. So it is not yet point for complacency. It is actually point for us to scale up our intervention so that we can be able to stop the transmission. The second one then is an appeal that we know what needs to be done. We have established the frameworks and the collaborations that are necessary for us to deliver on the containment. I think all we need is this resources to be able to push towards the end of control and elimination as we intend to do. So what do we need? We need funding to enable us to sustain the operations. We need support towards the production, procurement, and deployment of vaccines as a critical tool. We need also support in terms of improving the diagnostics and the decentralization that Nixie was talking about, so that we have quick turnaround time for vaccines. And we need more investment and research in therapeutics, which we have not talked much about for Mpox. The last one then is to communities. And as been mentioned, I think everyone has talked about, we cannot stop the outbreak on our own. And the communities, they have the power in their hands to get the right information, to apply that prevention measure and help us to stop the transmission, to collaborate with the responders when they are identified as a priority group for vaccination, to come up and accept the vaccine. So let us all work together, because we have the power in our hands to stop this Mpox outbreak. The last one is then the vote of thanks. I want to thank all the journalists for making time to listen to us, to probe, to ask questions. I want to thank the member states for all the work. They are dealing with multiple health priorities, and they have been able to allocate resources to sustain the response, to make the progress that we have had. We have had generous donations from a number of partners and donors. We are not able to list all of them. We are very, very grateful. And also then we are thanking the communities that remain resilient throughout this, despite the challenges, the communities in Eastern DRC that are fleeing conflict, but still collaborating with the responders. We want to say thanks to everyone. And as WHO, we remain committed to working with all the member states, to supporting the communities so that we can be able to interrupt this transmission. Thank you very much.
Thank you so much, Dr. Patrick Otim, Program Area Manager at the WHO Regional Office for Africa, for closing that. Thank you to all of you, our experts, for all the information shared with us today. Thank you to everyone who participated in this press conference. And pour maintenant, je passe ma micro à ma collègue Khadija pour qu'elle va modérer la session en français. And see you at the next